Okay, everybody, we're going to go ahead and get started. My name is Christy Fogel. I'm a practicing physician assistant in Baltimore City, and I'm also founder of the Maryland Progressive Healthcare Coalition. We are a coalition of progressive activists, healthcare leaders, and healthcare providers that are spread throughout Maryland, and we have come together to build power around Medicare for All together. And events like this, which are completely grassroots, are how we get this done. On behalf of the over 20 organizations that we have actually brought together thus far within the past couple months, I want to thank you for coming to this event and welcome you. And I want to waste no time in getting started. I'm going to go ahead and pass this over to the MC for this event, who is a very fierce and strong activist, chair of our revolution, Prince George's, Suchitra Balachandran.
Good morning, everyone. I hope you can hear me. I'm Suchitra Balachandran. I'm sorry I forgot to wear my fierce suit when I come up here, but it's great to see everyone. So I'm here representing our revolution, Prince George's, and our revolution, Maryland. I live in College Park. I've been a resident of Maryland District 5 for now nearly a quarter of a century. So I've been here a while, and I want to thank everybody who took the time to come here. It's been, I know Saturday, you have a lot of other issues and things to do, and so it's really good to see people. I also want to tell everyone that this event is being live streamed on several Facebook pages, so a big welcome to the live stream audience as well. Let me give you a brief introduction and walk you through today's program, and then you'll have an idea of what we're going to do and how the process is going to work. So we started planning this event about a couple of months ago, and we knew that August was a break in Congress when congressmen usually go back to their home districts and engage with their constituents, and we thought this would be a good time for us to have a conversation with Congressman Steny Hoyer on the issue of Medicare for All. And so we reached out to his office, we sent him several emails, we gave him a whole bunch of weekends in August when we thought we could schedule this, and we didn't hear anything back. And so we decided, well, we had to go ahead and fix a date and move this meeting along. So we did. We told him it's going to be on the 17th of August from 2 to 4 p.m. at Mount Enon Baptist Church. And finally, about a week before the event, we got an email from Congressman Hoyer telling us that he couldn't make it to this event. So we're sorry that he couldn't be here. We're glad to see his representative, who we hope will take the message that that comes out of this meeting back to him. So that's where we are. This is unfortunately going to be a meeting where Congressman Hoyer is not present. Under Medicare for All, basically, all residents in the U.S. would receive comprehensive health care, period. Health care would not be limited, as it currently is now, to those who have insurance, and your health care would not be negotiated through your insurance company, and your health care costs would not bankrupt you. As many of you may know, 118 Democrats in Congress have co-sponsored H.R. 1384, which is the Medicare for All bill that is, for which Congressman Pramila Jayapal is the lead sponsor. And among those who have co-sponsored it are Congressman Elijah Cummings, Anthony Brown, John Sarbanes, and Jamie Raskin. So 118 Democrats is also a majority of the Democrats in the House. So frankly, it seems a little bit odd to us, and maybe it seems a little odd to you too, that the majority leader is with the minority of Democrats on this issue. That's not where we think he should be. So we're still doing this discussion on Medicare for All, and at the end of this afternoon, we're all going to be a lot better informed because we have a bunch of experts who are going to talk to us, not just about the bill itself, but about the current state of health care in the U.S., the the cost of it, the program, the financing of it. I mean, any questions you have, you can address to the panel after they finish speaking, and I'm sure they'll have the answers for you. So we will have a panel discussion where all the panel members will speak. There'll be time for everybody to ask questions. And then once that is done, you will have time to tell Congressman Hoyer your stories and ask him your questions. So we'll have an empty chair town hall where you can address your questions to him. And since this is live streamed, I'm sure he'll get the questions and he will know our thoughts and concerns. Following that period, since we cannot accommodate all of you to tell all your stories and all your concerns and talk to him, our audio-video guru out there, John Spillane from Our Revolution, Prince George's, will be there to take your stories at the chapel. So there will be time afterwards for additional questions and additional stories through John. And when we finish with the story part of it here, we'll have a call to action. We have two wonderful nurses from the National Nurses United, which is one of the organizations that has been spearheading this effort forward on Medicare for All. And by the time we are finished, Reverend Delman Coates, who is the senior pastor at Mount Enon Baptist Church, will be back here. He's not here right now, but he'll be getting here from another event, and he will do our closing comments. So before I hand things off and to the panel to begin our conversation on Medicare for All, I want to take a few minutes, first of all, to thank the entire coalition and everybody who put all the volunteer work into this. You know who you are, so just give yourself a big pat on the back, and let's just keep going. And I want to take a bigger moment to thank the church. When we came here and we asked Reverend Coates for space to do this meeting, he agreed readily. But we didn't know that when he agreed readily that we would have access to the entire crew that makes up this church. And so this wonderful space that we have, the audiovisual capacity that this church brings to us, all of the people who put this room together, who organized refreshments for us, and the audio-video people at the back who are live streaming this event. I can't tell you how grateful we are to them for giving us this event to have this meeting. And so a big thank you to Mount Enon Baptist Church and everybody. And particular thanks to Deandra Prescott, to Danny Vincente and the AV crew, and many thanks to all the church members who are here with us to hear this event. So with that, I'm going to get this event started and going. And I think Jake Burdett was going to introduce our first speaker. Jake is with the, Jake is with Salisbury University, Progressive Democrats, and is going to say a few words to introduce Dr. Sriram.
Thank you. Hello, everybody. My name's Jake Burdett. Hello, everybody. My name's Jake Burdett, and I'm introducing Dr. Sriram. He's a physician at the National Children's Hospital. He's also the host of Dr. America, an innovative podcast about health justice on We Act Radio. And the healthcare system, it can be kind of complicated, so he's going to be explaining. We're going to hear from an actual doctor and health professional about Medicare for All and how the healthcare system works. So, Dr. Sriram, Dr. America.
All right, thank you. So to explain why I, as a doctor, am supporting Medicare for All, I thought it would help to kind of go through three stories. One that I tell as a provider, as a doctor. One is somebody who's taking care of patients. One of my, it's a patient story. And the last one is actually about me as a parent and how this impacts me personally. So 20 years ago, I started medical school. It's actually almost exactly 20 years ago this summer. And at that time, you have to fill out like a application and do like an essay, right? And on that personal statement, neither me nor any of my classmates wrote, I want to make sure when I become a doctor that I spend a couple of hours every day on the phone with the insurance industry or with the pharmacy to haggle over what has been done or not done for my patient. And I promise, if you accept me to medical school, I'll be one of the best, most patient people when you put me on hold. That I'll listen to every bit of Muzak that you can throw at me, and that when I finally get answered, I will provide for the umpteenth thousandth time everything that the person on the other end of the line wanted to hear about my patient. That this is what I really want to do with my time as a doctor, that I want to be the best wrestler against the insurance industry. I want to haggle. That is what I want to do every day, day in, day out, in between patients. I want to haggle with the corporations. That is my mission as a medical student, as a future physician. Nobody wrote that personal statement. Nobody writes that, right? And it's like, and I can tell you though, 20 years later, I would have a hard time denying that that's a big part of what I have to do. And it makes you wonder whether I should have mentioned something like that in my application to medical school. So I can tell you that a big part of my supporting Medicare for All is coming from a feeling of fed-upness with an insurance industry that has nothing to do with my patients, everything to do with profits. And I know for the last 10 years of fighting for the ACA that my patients will never be as big a priority as the profits when it comes to the insurance industry. Story number one, okay? Story number two is about a patient that I have been taking care of. I'm going to try my best to protect this child's identity. But what you guys should know is that she was born with some problems in her urinary system, okay? And, you know, from the time that she was born up until the time that she became my patient at age 5, this kid has been through surgeries, has been through long hospitalizations. Her parents, I mean, they have done the whole thing of like, it's mom's turn to be at the bedside, now it's dad's turn. And the parents, to their credit, when they weren't at that child's bedside, they were grinding and hustling to get themselves a better job because they felt that if we can get ourselves off of Medicaid and into private insurance, maybe our child's coverage and healthcare will be better, right? And so, but for years, Medicaid is taking care of everything. They're taking care of the specialists, they're taking care of the surgeries, they're taking care of all the follow-up visits. When there are complications, Medicaid comes again, and the child, when it comes to my care, is doing fantastic. I'm reading the health history, I'm like, this is impressive. Like, this child has done remarkably well. And so, but I'm left with the question of like, what is this appointment about? So I go into the room, and what the parents tell me is that the insurance industry required an appointment with me before they could get a follow-up visit with a specialist that they had been seeing for a long time, and to get some imaging study, which is per protocol imaging that needs to get done for the patient based off of what that specialist had said, right? So I said, so you mean to tell me that you're having to waste your time and effort and money to be here for me to give you guys permission to go back to the specialist that you've already had a relationship with? And they were saying, yeah, because that's what our private insurance told us that we had to do. I've been on the phone multiple times, tried to explain our situation, but they said that you had to be involved this time. I was like, okay. And the reason why I tell the story is actually what the mom said to me. She says, it's hard enough being a parent of a child with special health care needs, but I will crush that. I will do that work. I have no problem doing that work. That is my cross to bear. I do that. What I am not going to do is become an expert in insurance company policy and procedure. It is not my business to be in their business about how is it that my child and their healthcare fits into their business model. I'm not here for any of that. And she says, I thought that by working hard and getting a better job, getting private coverage, that somehow things were going to be better. I haven't seen it yet. That was story number 2. Story number 3 is about me as a parent, right? So a couple of months ago, my child is having a fever in the middle of the night. I'm exhausted, okay? She's about 1.5 years at this point. And, you know, she's been a little bit sick, but finally my wife and her and everybody is asleep. But my wife is like waking up, it's like, hey, she's feeling really warm. I'm like, she's gonna be fine, like, it'll be fine, it'll be fine. Like, I'm dog tired at that. And then she's like, no, she's really hot. So we check her temperature and she's 106. Okay, exactly, right? Whoa, okay, so this means like, you know, I jump out of bed. I am like, pulling on my stuff, like, let's pack it up, let's go. Like, I grab my baby, like, I'm like, we're going in the car. And you're trying to do that kind of like, be cool as a parent because your kid is gonna read you kind of like, but you're going through all this as a parent, right? But I have no hesitation about driving to that emergency room, getting her checked out, and being a parent, not a pediatrician for her. We do the right thing. She's fine now and all of that. Months later, I get the bill. $500, right? Now, a $500 bill is not going to hurt a pediatrician, okay? But I think about that $500 bill, I'm like, it shows up in anybody else's mailbox, and that is devastating for that quarter of that family's finances. That's a home repair that doesn't get done. That's somebody's tutoring that doesn't happen. That's people struggle to put that money together, and for doing the right thing as a parent. So this is why I support Medicare for All. Now, I only have a little bit of time left, so I really want people to just know what are the main things that you need to know about Medicare for All before I let the other speakers kind of elaborate more. First and foremost, this is not the Medicare that we have always known. This is going to be improved Medicare, okay? First up is that Medicare has gone through these evolutions before. If you're on Medicare in 2019, it's better than the Medicare that people were using in the early 90s. That was better than the Medicare in the early 70s, which is better than the Medicare passed in 1965. The reason for these quality improvements is that healthcare changes, and we also learn more about our patients. Medicare for All is going to cover vision, dental, hearing. I don't mean to run through that quickly, but the number of times I've seen grandparents with tape on their eyeglasses, I'm like shocked that we don't cover glasses, right? We're going to finally get the cost of prescription drugs down because we're going to be negotiating for 310 million people in this country, not just 50 million people on Medicare or nobody the way that the current system does. So knocking down those prescription drugs means that we have to have everybody in. And the third thing is that we're going to actually be covering all of the things in healthcare that will eventually give people peace of mind. We're going to do it without the financial hassle of the insurance industry. So this is why I've become a supporter of Medicare for All. We're going to be talking a lot more about the details, the nuts and bolts of the bill through the rest of the speakers. But these are the main points that I want people to know. That as a pediatrician and a parent, this is my journey to this bill. And I'm looking forward to learning more from the rest of the speakers. Thank you.
Thank you, Dr. Sriram. We now have Chrissy Holt from Progressive Maryland to introduce our next speaker.
It is absolutely my pleasure to introduce Alex Lawson of Social Security Works. He is the executive director and also the founder of We Act Radio, which is a DC-based progressive media platform. And he's going to talk to us today and dispel the fiscal myths of Medicare for All.
Thank you so much, and thanks to everyone in the room and to everyone who put this on. When we win Medicare for All, it's going to be because of you all. It's going to be because of meetings like this. So I'm going to ask you all to give yourselves a round of applause as the most important people in this fight. Please. And I always say that because how many of you all have been fighting for improved Medicare for All for a while? Yeah. We've been fighting for a while, but it does seem now like the wind's at our back, right? You know how I know that? It's because pharma and the insurance company are dumping in hundreds of millions of dollars to stop this effort. They are buying politicians left, right, and center because they are scared of what they know to be true, which is that we cannot afford our current healthcare system. Our current healthcare system is unaffordable. It's unaffordable for everybody, for the country. It's unaffordable for every individual as well, because even with the best coverage out there, you can still find yourself in a situation where you can go bankrupt in this country for getting sick or having an accident. Do you know what a wrong concept that is? That we allow that concept to exist? Medical bankruptcy? That's an abomination that doesn't exist anywhere else in the world. We allow it to exist. And then they say, how can we afford to provide health care to everyone in this country? Medicare for All saves money. You all know that, right? Does it save money or does it cost money? So what's the right question when it comes to Medicare for All? Is it how are we going to afford this? Or is it what are we going to do with the savings? How are we going to ensure that the savings from transitioning to an improved Medicare for All system are distributed mostly to those who have been harmed by this system for decades? Because that's what this system does. It actually hurts people for profit. People sometimes say that the healthcare system is broken. Have you all heard that? The healthcare system is not broken. It works perfectly well. It's just not a healthcare system. It's a wealth extraction system to make private equity and hedge funders so rich that they couldn't spend all of their money in 10 generations. That's what it does. And how does it do this? I want to go through the business model. It's really complicated, so follow along with me. It's going to be very complicated. They take your money and they deny your care. Full stop. That's it. It's actually not complicated at all. They take your money and they deny you care. They cannot make money any other way. They take our premiums, and then when we get sick or injured, they put up roadblocks. They either tell us no, or they put up roadblocks to deny us care, counting on the fact that we are not going to fight them on it, counting on the fact that we are busy people who have lots of things that we have to do. And so when we get a denial, or something Sanjeev said about the medical bill that I like to kind of point out, I started noticing it with my children, actually. Why do the bills come randomly, like 5 weeks later, 8 weeks later, 2 days later, right? Like all chopped up, you get one bill from this doctor, one bill. Who could actually sit down and actually map out whether or not we're getting ripped off? You don't have to wonder. They're nickel and diming us, and they're just robbing us blind. Does everyone agree that this is what's happening? And that's just the insurers. Can we talk about the pharmaceutical industry for a second? We pay to develop the drugs. It's our tax dollars that go to the NIH, that go to the other labs, that go to the universities to create the drugs. Do y'all know that? Do you fully know that it's your money, it's our money that create these drugs? And then we give the patent to these $100 billion corporations. Many of them are not even U.S. corporations. And the U.S. corporations turn around and take some of that and don't pay any taxes in the U.S. We literally give them the patents, and then they charge us the highest drug prices in the world. That is not right. Donald Trump said that he was going to lower our drug prices. Has that happened? 10.5% this year. That's the average that our drug prices have gone up this year so far. 10.5%. That's if you're lucky. If you're unlucky, some hedge fund pharma bro buys your drug, jacks up the price 7,000% so that he can get another golden yacht or go to Burning Man or whatever it is that they like to do. Buy the Wu-Tang album, whatever it is. It's a con. They're ripping us off. That's the pharmaceutical industry. And do you want to know how they get away with it? They make hundreds of billions of dollars, and they dedicate a teeny tiny piece of that. Hundreds of billions, hundreds of millions of dollars to buy politicians. So that those politicians protect the insurance industry and the pharmaceutical industry to continue robbing us. They take our money, they deny our care. That's the only way that the insurance industry works. Medicare for All saves money. It saves money. And we get vision care. We get dental care. We get hearing. We get long-term care. We treat people, not as profit centers, from birth to death, covered, because it's a health care system. Do y'all know what the average cost of long-term care in this country is, nursing home care? $118,000 per year. Do you know what system we have to deal with that? None. None. There is no system. We just happened to use Medicaid because there's no actual system. So we actually tell people, oh, well, actually you should hire what do they call them? Not a home health aide. No, the people who, they do good work, but they come in and they say what you need to do is spend down your assets. You might inquire into getting a divorce and declaring bankruptcy, because otherwise you're going to bankrupt your family. These are the decisions that our healthcare system forces people to make. That is not right. Heal the sick is something that you hear in almost all faith traditions as I'm standing here. Heal the sick. There is no but. There is no if in that statement. It does not say if they can afford the copay, if they can afford the deductible, if they can afford the premium or the drugs that their doctors are telling them they need. It does not say that. We need to build a healthcare system, and we will, with everybody in, nobody out, no premiums, no deductibles, no copays, comprehensive coverage for everyone starting at birth. That's what we're going to do if we keep our eyes on the prize. If we stand together, they cannot ignore us, and they'll never defeat us. Thank you so much.
Thank you, and I think we're just getting started. So now to introduce our next speaker, Dr. Gomez, is Steny Jacobs from Healthcare is a Human Right.
Can't get on the stage here. So how do I? Is that it? Oh, yes. All right. All right. Thank you. So I am very pleased and delighted to present Dr. Ellie Gomez, who is a health policy advisor, a physician trained in emergency medicine, and an associate professor at Howard University College of Medicine in Washington, D.C. Ellie is also a lifelong community activist. He's done amazing work throughout his life. He's worked with at-risk youth. He's found solutions to opioid and gun violence, and he's currently doing research on health disparities in underserved communities, and that's what he's going to talk about today. Please welcome Dr. Gomez.
Thanks. Thank you, Sydney, and good afternoon to everybody. Man, that was a great, that was a great speech. That's good. I'm not as good at speech making, but I will tell you that I've been fighting this fight my entire career. Very similar to Sanjeev. I didn't go into medicine to use the model that we have now, which is not a healthcare providing system primarily, but a healthcare money-making system. This is problematic on a lot of levels because it's very confusing and non-transparent to all of us as patients, as consumers. So I want to start out with that, reiterating that issue. The system is not primarily designed for our health. This is problematic, and the first and most important reason why Medicare for All is the only reasonable choice, and it's the only reasonable way to go forward. It's designed to make money. As you know, Damon Tweedy has shared, Dr. Tweedy wrote a book called A Black Man in a White Coat. And when he tells a story about how he is treated when he goes to medical care as a patient, it informs a little bit about what's going on. Our country has historically been incredibly discriminatory against people of color, black people in particular. And that's intimately tied to the assumption that we don't have the same value. So a part of the problem, not the entire solution to health disparities, is to give everyone the same value. We all count. We are all valuable under a universal healthcare system. Our current system tends to look at minorities in general as potentially a weaker economic option. Now, if they were working for your health, be not an issue, right? Because then we could just care for your health state. But in fact, what's happening is they're immediately looking at you as a billable entity. And so very many people make the misassumption that if you're a person of color, you might not have the means. And now it's inculcated in their mindset, clinicians' mindsets, and administrators' mindsets, that that's who you are. And so they devalue you. And so you have tragedies like what happened with Serena Williams and what Dr. Tweedy describes when he went to medical care and was dismissed as, you know, not having a very important issue. When he shared who he was and what his occupation was, then all of a sudden, everybody wanted to take care of him. That should not be the deal. That should not be what we are encountering when we come into contact with the healthcare system. Another problem, our public health system is incredibly politicized. The chief administrator of CMS was appointed by Donald Trump. And the reason she was appointed by Donald Trump is because she was the CEO of something called Seema Verma Clinic. It made millions and millions of dollars. Interestingly, Ms. Verma is not a doctor, is not a nurse, is not a clinician of any kind, but a very, very effective businesswoman. That's who's running, that's who's taking our tax dollars and then redistributing them back to the private sector health insurance companies. And it seems like we're paying for a service, but we're actually paying for a service twice. So Alex talked about saving money. That's a key reason why it would save money, because we're not paying for it twice. Another issue that sticks in my craw, we have a problem with the issue that you're trying to take care of your family. You're not a business person. You're not an insurance agent. You don't understand the workings on the inside, and that's purposeful. There's a lack of transparency on purpose, and there is misinformation on a constant basis. You're being told that you're dealing with caretakers, that you're dealing with providers, that you're dealing with people that are in charge of your care. But the individuals that you're seeing are neither doctors, nurses, nor PAs. The people that you're seeing represented are trying to do their best to earn as much money for their companies as possible. So they describe themselves as your benefactor, you know, people that have your best interest in mind. And by giving you a very, very little bit, probably not, this doesn't apply to the individuals in this room. But by giving the public a little bit, it gives them the idea that, well, at least they're giving us coverage, so I don't want to lose my private insurance. In fact, what they're doing is taking as much possible and giving you as little as possible in return. So please take this with you. Not everybody that you're seeing is a doctor who's taking care of patients. I got my MD to take care of patients, just like Sanjeev did. And there are many of us out here. But you will not hear from us when we're talking about designing a healthcare system. You'll hear from people that are heads of corporations. Now, they may also have an MD, they may also be RNs, but they're administrators and they're business people. And the people that they are in most close association with are MBAs. They didn't allow me into that discussion when I first started 20 years ago. So I got an MBA. And lo and behold, I said, look, there's enough money here to take care of all our patients, and the company can still make money. And they quickly disinvited me from the C-suite, which is why I'm here today speaking to you now. So finally, you know, I don't have much time. There's so much to discuss. But I do want to pick this one issue, that health disparities are a serious issue in this country. For every 100,000 Americans that for every 100,000 Americans, 208 black people die of heart disease every year versus 169 white people. That's not coincidence. That's not arbitrary. That's proven again and again in various, in various disease states. This is very essential that we move at least to the point of incorporating everyone as covered. If we do not, we have no hope of achieving health equity. And I hope that resonates with the community around the church because it is vital to the community that I have dedicated my life to represent and to help. And that's all I got for now. But I hope the questions that you ask help us bring out a lot more of the points that we want to share. Thanks.
Thank you. I'd like to now invite Diana Denboba of the Prince George's chapter of the National Congress for Black Women to introduce our next speaker.
It's on. I would like to introduce, and it's my pleasure to introduce, Elisa Ware, who is an MSW social worker and project director with Family Voices. Family Voices is a national organization with state affiliates that works in behalf of children with special health care needs, their families, and the providers that serve them.
Good afternoon. So I want to talk about the family perspective, which is near and dear to my heart. I work every day with families across the state of Maryland and across the country as a social worker and a family leader to address the families that have children with special health care needs. Many of the families that I work with have talked about the challenges in acquiring and affording quality health care for their children. The needs of their children are great and often come at a high cost to families due to the current structure of the health insurance system. While many of these families have health insurance, the insurance does not meet their needs and places the family in a position that often leaves families deciding between getting their child the services that they need or keeping a roof over their heads. One example that I wanted to bring forth was I worked with a family and their child had an autism spectrum disorder. The gold standard of treatment for autism spectrum disorder is applied behavioral analysis, and the standard of care is typically 40 hours a week of service. This family felt desperate. They wanted to get this service for their child, and Maryland actually has a mandate that says that insurance companies have to cover it. What the mandate doesn't say and doesn't cover is that there's typically at least a $30 copay per hour of services, if not more than that. So at 40 hours a week, you're talking about $1,200 a week for services to get the gold standard of treatment for autism for their child. So this family took out a second mortgage on their house, ended up spending well over $50,000 in treatment for their child that they ultimately had to discontinue and file bankruptcy in order to keep their home. These atrocities exist all across Maryland. Families do what they want to get the treatment for their child. They want the best options for their child. They're trying to figure out how, and the cost is just too great. In fact, just this morning, I was posting about being here, and I posted the event, and a parent commented, and I want to read what she said. She said, "As I sit here working on a budget worksheet, my husband has to make enough not only for our home's mortgage, but an additional $2,000+ per month just to cover our son's therapies. And this isn't even including the bills we will receive from the specialists. While there are Medicaid waivers, as I said, in the state of Maryland that would cover the cost at 100%, there is currently an 8-year wait list just to determine eligibility. With Maryland having the second highest rate of autism in the country and 1 in 5 children having a special health care need, families cannot afford to wait 8 years to receive health coverage that will make treatment for their child affordable and accessible. For this reason, Steny Hoyer needs to sign on to the Medicare for All bill today so that families no longer have to choose between their child's health care and keeping a roof over their heads due to a broken insurance system. And thank you. And I just want to touch on something that was said earlier. You know, when we talk about health disparities, it is great. And I stand up here as a parent of a child that is on the autism spectrum. And she didn't receive a diagnosis until 8, and I was asking all the right questions. But I had providers that passed me on from one specialist to another and didn't take my concerns seriously and didn't listen. And so ultimately, my child missed out on many of the early intervention services that could have been helpful, many of the treatments that could have been helped. But then there's also, back to why we're here, an insurance issue with that. I had to go to this provider in order to get a referral, in order to go to the next provider, and oh, well, we don't take your insurance at Kennedy Krieger. Oh, we don't take your insurance here. And so there was barrier after barrier after barrier. And so she was 8 before she received the diagnosis, when we know today you can give a diagnosis at the age of 18 months old for a child on the autism spectrum. So I just really implore Steny Hoyer and other legislators to really think about the families that are impacted by the current broken healthcare system that we have, health insurance system. Not, the healthcare system's fine, the insurance is the problem.
Thank you, and I'd like to now invite Dr. Laura Kaplan-Weisman from Our Revolution, Maryland, to introduce the next speaker.
Thank you. It is my honor to introduce our next speaker, Walla Blagay. Walla Blagay is an attorney, and she's representing the DC Nurses Association, and she's going to address the fiscal crisis and hospital closures. Welcome.
Good afternoon, everyone. I am so happy to be here today because I've been, like many of you all, fighting for Medicare for All for a very long time. My story actually began when I was, it was about maybe 2002. I was 18. I had a allergic reaction, went to the emergency room at Washington Hospital, and was told afterwards that I was no longer covered under Medicaid, that I had had for a time because I was over 18, and that I had to pay $3,000. At that time, my parents were immigrants. We didn't even have $10 in a savings account. And for me, that was frightening because it went on my credit. We had to fight it, and finally it went away. And that kind of opened my eyes. Now in 2018, I had some health issues, went to get an MRI and other things, and got another $3,000 bill. It's different now. I'm an attorney. I can afford some of it, but $3,000 is a lot. And for a lot of the people that our nurses serve, they cannot afford that. So it's the same. We're looking at almost 20 years and the same problem. We cannot sit in this room 20 years later and talk about the same problems. Medicare for All right now. So I'm representing DC Nurses Association. We are affiliated with National Nurses United. We represent nurses throughout the district, including Howard United Medical Center, Children's, and throughout the district government. One of the reasons why I'm here, because many people talk about how it impacts individual families, and it does, but it's also actually impacting hospitals in low-income areas. And it is when we started looking into this, we were shocked at just how much the insurance company even play into the hospitals that are closing across the country. So starting off with, we represent nurses at United Medical Center. And United Medical Center is a hospital that was once my neighborhood hospital. I grew up originally in the District of Columbia in Southeast. And, many of you all know about Southeast. Southeast is a mostly low-income area. Most of the individuals there usually have Medicaid. Some do have private insurance. In fact, some do, and especially now as things are changing. But when we looked into a lot of things, we started to see a trend. First of all, one of the reasons why nurses have been backing Medicare for All. We have a lot of bedside nurses who provide care every day. They just focus on healthcare. Like many of the doctors up here, it's all about healthcare. But we have our utilization nurses. And utilization nurse looks at the care, and they have to call the doctor and unfortunately tell the doctor, hey, look, you can't do all these things because the insurance is not going to cover it. And that's what's holding a doctor back from being able to actually do their job, because a nurse has to painfully make that decision and say, look, you can't do the MRI, it's not covered. You can't do this, it's not covered. You can't have this surgery, it's not covered. In fact, they can only stay in the hospital for 3 days because that's the only thing that's covered. And if it gets to the point, so one of our nurses said that one of the doctors was just frustrated and was like, look, I need to do this to help my patient. And they had to talk to a head doctor because it's one of those important things that happens. Now, United Medical Center, we're fighting a hospital closure. And we're fighting a hospital closure because what we found is that when insurance companies, the way the process works is that, let's just say a doctor's visit is $250. Each hospital negotiates with the insurance company on how much they pay. So GW, or Georgetown, and we're talking about DC here, is able to say, look, we are going to negotiate it at $180. Now, every hospital is labeled and said, this is a good hospital, this is a bad hospital, about outcomes. But with low-income communities with limited resources, hospitals in those areas will never have when you talk about outcomes, you're talking about people with a lot of chronic illnesses, you're talking about limited resources. When you're talking about outcomes, what does that mean? So that hospital, United Medical Center, even a hospital like Howard, that has a certain community going there, they're going to be rated lower, not necessarily because they're given bad care. It's because of limited resources. It's because of people that are there, but they're going to be rated lower. So the insurance company is going to pay GW, Georgetown, more money. They're going to pay them the $180. They're only going to pay Howard maybe $110, and they're going to give United Medical Center $90. That's how this works. So how is it that these hospitals can do it? So if you're on Medicaid, Medicare is the actually only thing that has a set price. So you get paid what you get paid with Medicare. And Medicaid, it depends on what city you're in. So if you're in DC, you're going to get more, but if you're in Maryland, you're going to get less. So it is one of those things right now that it's encouraged. Those people that live around low-income areas are encouraged to go take their, go to GW if they have private insurance, go to Georgetown. So now their hospitals are closing. We did a search and we found all throughout the United States, we have low-income hospitals closing everywhere. And it is closing because there is simply no, insurance companies are saying, we're not going to pay this, we're not going to pay this, they're paying them low, and they have nothing else, and they're having to shut down. And when we met with Congresswoman Eleanor Holmes Norton, she said, look, hospitals are closing, that's just what it is. That's how Congress looks at this. That's how our elected officials look at this. This is just how it is. And unfortunately, this means that if you live in a low-income area, you're going to have to drive in your car, even if you are sick, and go somewhere else to get really quality care. How is that fair? And we're talking about the racial impact that has. What did those communities look like that these hospitals are closing down? Let's just call it what it is. If we don't stop this, that means that in certain areas, you're just not going to be able to go to a hospital. And that's what's going to happen. Medicare for All stabilizes everything. It allows you, if you go to Georgetown, they get the same payment. And it would be better because they're saying, oh, but Medicare just pays $100. Well, Medicare can pay more if they don't have to compete with the private system. So you put it all equal. All equal. Everyone gets $150, whether you go here or whether you go there. But the system must change. And when we're seeing this, we're saying, this is what we're doing, and no one sees it. And let me just tell you about private insurance. A lot of people, we have people that are saying, oh, I love my private insurance, until it doesn't cover something. And when it doesn't cover something, a lot of people, I'm an activist in my community, and I do a lot of legal work, and I've got a call the other day of someone trying to sue an insurance company because they denied their health care. Nothing you can do. Because they wrote that contract that you signed. In fact, you signed it through your employer. You didn't even sign it on your own. So you don't have any negotiating power. So now you just got to take the denial. And 2 weeks ago, I had to help another woman find a bankruptcy lawyer because her husband got cancer and they're now in bankruptcy. Because they cannot afford things. They have to do bankruptcy to save their home. Medicare for All today. Thank you.
Thanks to everybody for that really stellar piece of information that we have all been listening to. And as I was listening to it, I was thinking, gosh, we have some really clever minds who've designed this system in a way that it takes all our money and it actually, you know, I mean, every single corner that you turn, and we are a lot of people in this country turning many corners, you find a stumbling block. I mean, just think of the genius that designed our current insurance system to ensure that they take our money and don't give us service. I mean, that's what I've learned today. And it's just, I mean, it's astounding. No wonder they don't want to give it up. They've spent a lot of time designing this program, and it's working for them. It's just not working for us. So what we're going to do now is to take questions from the audience to our panel, and Chrissy and I will be around with microphones to you. So just raise your hands.
I don't really need a microphone.
Is this on? It's on.
Oh, now it's on.
Okay. I used to teach. I didn't need a microphone. So my name is Brianna Urbina, and I'm running for Congress here in Maryland's 5th District. Okay, you can clap. You can clap. I'm running to fill the seat that wasn't occupied by Steny Hoyer today. And my question is for Steny Hoyer, because I know that he's listening to this. I know that I get his emails all the time. Every time I send an email out, he sends an email about the same thing. So my question to him is this: how do you call yourself a leader if you're not listening to the people in this room? If you're not legislating for the people in this room, how can you call yourself a leader for us? Yeah, you go ahead. I moved to Maryland 7 years ago because my wife and I didn't have a lot of states we could live in 7 years ago as a married gay couple. And we previously lived in North Carolina, and it took my brother 12 months as a person with a disability to get Medicaid eligible there. So we moved to Maryland because we wanted progressive representation. And I'd actually met Steny Hoyer when I was in North Carolina, and I was excited to be moving to his district because this man had power. This man had power to change lives. But power without a purpose is useless. And so my question to him is, why aren't you here? And how can you, what do you say to those people, like the child I was who grew up without insurance, like the child I have that I worry about his healthcare needs, like the women who I go to church with who fought for public integration of accommodations here in Maryland 50 years ago, and then now have to fight to be seen by doctors for the evidence of that systemic racism, diabetes, asthma, heart disease. Those are things that are caused by systemic racism. Look it up, just like the doctor said. And what do you say, I don't know, what do you say to the people in this room who are sick and tired, who've had enough, enough is enough? That's my question to Steny Hoyer. I'll be here afterwards if you want to talk to me.
Thank you. Did somebody on the panel want to have a comment or respond?
I mean, it's a great question because, you know, I mean, a lot of the people who are not supporting the Medicare for All bill in Congress, who are Democrats, they are saying that, well, why don't we just keep tinkering with the ACA? After all, the ACA was so hard to get. Why don't we just keep tinkering with it? The point that I make, and another reason, there's many reasons why I'm a Medicare for All supporter, but another big one is that, I mean, this is the most important racial justice policy of our lifetime. 59% of the uninsured in America are people of color. In Maryland, that number is up as high as 78%. This is despite the fact that Maryland is, you know, a blue state, early adopter of the ACA, did all the things with Medicaid expansion, did all the things to, so-called regulate the insurance industry. And despite that, you have over 400,000 Marylanders without health insurance, disproportionately represented by people of color. And I mean, we have to account for that. We have to account for where things have fallen short and where Medicare for All can move us forward.
Yep. Thank you. We have another question over here.
Yeah, I just wanted to touch base because the other